Hi, Dr. Soul. Thank you for joining me on Access Child Neurology for our discussion about transitioning from pediatric to adult healthcare. I'm Elizabeth Stout, a young adult with epilepsy, and I personally completed the transition to adult healthcare last year. And I also work in a variety of ways to help other youth find a smooth transition themselves in this process. And I am excited to hear about your perspective on the topic as a healthcare provider.
Well, thank you for having me, Elizabeth. So a bit of background on me. I'm a neurologist. I've been a neurologist for more than 30 years. I trained in child neurology, which includes training in adult neurology, and I've practiced both up until about a year ago and transitioned into the adult neurology space. But I've recognized for a number of years now that the challenges having to do with transitioning from a pediatric to an adult neurology provider for patients with various neurologic conditions, including epilepsy. So I'm at the University of Louisville and a professor of neurology, and thank you for having me.
Okay. Can we start with you telling us what the 8 common principles to assist with the transition of care include?
Absolutely. So the 8 common principles were published in around 2017, I believe, and have to do with a systematic approach to completing a transition of care from a pediatric neurology to an adult neurology provider. But step one is expectation of transition. So, first step is, of course, to set the expectation that eventually your child or loved one will be transitioning to an adult provider. And typically that occurs between 18 and 21 years of age. Um, so it's just opening the door to a discussion about transitions of care. And typically we like to have that completed by the child's 13th or 14th birthday. Uh, the second step is yearly self management assessment. So the provider should make an assessment of whether or not the patient is capable of self care. And that could be as formal as neuropsychological testing, but more commonly is sort of question and answer about medications, for example, compliance with taking medications. And as children progress into adulthood, for example, they often assume their own health care, and it's a process, so it's a transition. So we want to make an assessment at various points between the ages of 13 and 18 or so of whether this is occurring or not, and have some sort of documentation and idea about that. The third common principle is annual discussion of medical condition and age appropriate concerns. So, education, of course, is a large piece of what we do as neurology providers. And so, in addition to various handouts or resources, and they're fantastic resources, of course, the Child Neurology Foundation website, including the Rare Diseases Finder, we are having a discussion about the medical condition and developing some understanding of the patient's ability to understand their own condition. Um, the fourth point is that of evaluation of legal competency. So at some stage, the uh, the child becomes chronologically an adult, uh, and typically has to transition to an adult provider sometime between 18 and 21 years of age, typically. And so we have to have a discussion with the parent and or caregivers about legal competency and ability to deliver self-care and advocate on one's own behalf. And so that is the fourth step, or fourth common principle for transitions of care. The fifth is annual review of the transition plan of care. So there does need to be an overall plan of care. And the Child Neurology Foundation website has wonderful transition tools to accomplish this and to kind of remember the 8 common principles. The sixth step is the child neurology team responsibility. So, kind of dividing up among the members of the child neurology team, various responsibilities and completion of some of the tasks. So, for example, many centers we have an interdisciplinary care team, which may consist, in the context of epilepsy, for example, there may be a nutritionist if there's a question of ketogenic diet. There frequently are social workers who can assist with transportation or financial issues. Um, and of course, there's often a nurse navigator or nurse care provider who can assist with the transition of care plan of care. The sixth is, the seventh common principle is identification of an adult provider. So typically, by the time the child's about 17 or certainly by 18, a specific adult provider needs to be arrived upon, and that's typically arrived at that decision by involving the parent or caregiver as to who they might wish to transition to, or if you, as a pediatric provider, know somebody to transition the care to, then you would want to identify that person, and so that the parent or caregiver can develop their knowledge base about the background and educational level of that person. And then step eight, of course, is transfer complete. So by the eighth common principle, we want to make sure that all of those eight steps are completed, including the overall transition plan of care, so that you can make a smooth transition then to an adult provider. And that adult provider will then be informed about the plan of care going forward.
Okay. And having made the transition myself and reflecting on it afterwards, I certainly have seen why having all of these specific principles is important for having a successful and a positive transition. Because even though my transition was just within a hospital system and I only physically had to move over one building, it definitely involved a lot more changes and adjustments than I originally expected. Um, Such as how there were changes related to the communication and relationships with the provider, a lot related to the responsibilities that I individually held as a patient and not having things on my parents' shoulders anymore, and also many of the factors outside of the health directly, like, as you mentioned, insurance, legality, and finances for care, that definitely were not part of my role when I was in pediatrics. And I personally did not have a specific transition plan of care. And looking back on that, I think that would have been very helpful to have it been more detailed and specific about how things were going to work. I was lucky in that I'd say my transition was relatively smooth because my team and my parents did work very hard to make it effective. But there are some spots that it would have been helpful to be a little more detailed and strongly planned out versus kind of just go as it comes along. And
Absolutely.
if these principles are based on research, why don't doctors necessarily follow them?
That's a hard one to answer, but I think that what we're trying to do is bring a more systematic approach. Actually, I quote a pediatric ophthalmologist that was a friend of mine at Harvard. He used to say that if you're not systematic and organized, you're lost. And we don't want our patients, of course, to be feeling lost. So it provides a framework, I think, and that's what I think most clinicians need, is some degree of framework or structure in order to kind of complete the tasks necessary. There's probably more than one reason. I think in general, unfortunately, pediatric and adult providers, in not just in neurology but in any specialty, don't necessarily, I'll say, hang out together, but overlap in terms of their professional day-to-day activities. The pediatric hospitals tend to be specialized, and the adult hospitals tend to focus on adults. So I think that this provides a framework, a common language, a familiar uh, format to most providers in terms of having a discharge plan or a plan of care for transitioning that child, uh, and can bring up that subject, beginning, 13th or so birthday, something like that, so that there can be a smoother transition.
Okay. And as I mentioned, I was lucky that my parents and my provider did work to help make my transition easier. And a big part of that was by working to make it a gradual process. Um, my family started encouraging me relatively early, when I was around 13, to become more independent and involved in my healthcare. And originally, this was little things like knowing the names and dosages of my medications. So when there were questions about that, I was able to respond, and also answering and asking specific questions myself. And this progressively increased and moved along to, by the end of the situation, holding the vast majority of the conversation with my provider and knowing the details of my health. So, related to the um, topics and principles you mentioned about these self management and medical condition knowledge, because um, I had to know the details of my health, including the difficult parts and the negative topics related to conversations, such as how my epilepsy is medically resistant. And my parents, even though it was hard to want to talk about that, knew that it was important, because when I was going to be the adult, I certainly needed to know about that. And I also did things like I started to fill out my forms independently, and also would make my appointments and things more on the financial and legal sides of this. And my provider also assisted with making this gradual by acknowledging that I would have to make the transition, and also describing how it would work within the system. So this helped to make me more prepared by having a understanding of what it would be like, but it was also somewhat challenging, since I really did not want our partnership to end. I had a very strong connection with my provider, but her decision made me more prepared for the change, and I definitely know that without the efforts of both my parents and my provider, the transition process would have been much more sudden, and therefore very much more difficult for me, because I like to have things be gradual, because I would have known less about what the adult system would be like and be definitely less prepared. So, can you share about your project to use Epic to assist with the transition process?
Sure. So the recognition, several things kind of coalesced all together, but with the recognition of the need to have a more systematic approach to transitions of care, um, the from just a conceptual framework, where the goal is to use the electronic health record and incorporate the 8 common principles into the electronic health record, to then sort of prompt healthcare providers to be discussing transitions of care. We you know Human nature being what it is, one doesn't like to necessarily think about our patients leaving us, but it is a reality that the patient ages out of the system. And so our goal with the project is kind of twofold. One is kind of as a scholarly activity, uh, assessing pre and post intervention um, chart review to look at whether the 8 common principles are being observed, adhered to, and documented. And then, so, so our intervention is to do some customization within Epic to incorporate the 8 common principles. And then we also, separately, as another research project, we are uh, obtaining surveys for feedback from parents and caregivers of children with the subpopulation of individuals with intellectual disability and epilepsy specifically, to see what the barriers are for a smooth transition to an adult provider. And so we're kind of in the midst, actually, of both. We have distributed the surveys here locally in Kentucky, and then hope to obtain feedback from that, and then also doing the chart review at this point. So we have IRB approval here at University of Louisville.
Okay. And what do you think is one of the most critical steps of transition that is often missed or overlooked?
I would say probably every part of it, as outlined by the Child Neurology Foundation and the Eight Common Principles, every part of it is important, but maybe probably the most overlooked is specifically identifying a provider. So it's very easy from a healthcare provider standpoint to just refer to neurology, but for example, in the context of just in the group of neurologists, adult neurologists, each have their subspecialty. And so, for example, in a patient who has epilepsy, then you want to make sure that you transition to a neurologist who is an epileptologist also, and so that that person can achieve maximal benefit of the knowledge of and background of the provider, but also potentially some of the resources that have been arranged over the years for patients with epilepsy.
And that was another way that my provider actually helped, because she didn't just tell me, you're going to adults. She gave me information about, we think that you would fit best with this provider who specifically is a epileptologist and has a background with your situation, since I have a responsive neurostimulator, which is not what every provider is used to dealing with. So it was very helpful to have some guidelines and suggestions about a particular individual rather than just go to neurology in general.
Absolutely, I think that the more specific or the more off the beaten path, I'll say, the therapies that are in place, the more specific you need to be from a healthcare provider standpoint about identifying an adult neurology provider who specializes in that area, so that all the needs can be met with respect to the condition.
Okay, thank you for joining today, and I look forward to continuing our conversation on episode 2.
Thank you.